This week in the clinic, I got to see Pat Rainey. It was great to see him again. I fused his back about 10 years ago. He was doing great until a week before a visit in the clinic, and something went seriously wrong. Pat had some knee trouble. He laid off his usual 5-mile-a-day exercise walk, and when his knee got better, he went out and did the walk, and sure enough, a day later, bam, extreme back pain and pain shooting down the leg. If you've ever had sciatica, pain down the leg due to an inflamed or compressed herniated disc, I just want to say I am sorry. It is wicked painful. It's more pain than a lot of people have ever experienced. It's kind of childbirth-like pain. If you've had that kind of pain, then one light bulb went off in your mind. You had one question, and that is, what happens now? That's the purpose of this video. We're going to answer that question, and if you've had sciatica or if you're having it now, we're going to tell you what you need to do. Is a herniated disc serious? I mean, most of the time, no, but there are a couple of situations where, yeah, it really can be. Look, herniated discs are extremely common. The fact is, most of us are going to experience it sometime in our life. And as we said in the last section, 94% get better on their own with no intervention of any kind. Now, having said all that, as contextual framing, there are two situations in which a herniated disc is a serious problem. Number one, if the herniated disc is either putting direct pressure or it is causing so much inflammation that it's damaging a nerve root, then you can get permanent nerve root damage from a herniated disc. And that could correspond to permanent numbness, permanent weakness, or long-term pain, nociceptive, nerve root type pain. All three of those are bad, right? No one wants to have numbness, but you may think, well, who cares? Well, you would care. If your ankle is so numb that you can't put on shoes and walk normally, that's a huge problem long-term. Weakness is weakness. Your feet and the nerves that your low back controls are involved in your gait. And so any kind of problem like a foot drop where you're walking and your foot is slapping on the ground permanently disrupts your gait, can cause all kinds of other problems as well, or even make it hard to walk. And then the reverse problem where you can't push off, so you're sliding, you're having to drag your foot. So permanent weakness is obviously a huge problem. And then, there's nothing more disabling than pain itself. If you damage a nerve root and you get permanent nerve root damage, you can have permanent pain signals going to your brain. Pain is the normal function of pain is to alert your brain to an emergency. So, ooh, my foot's in the fire, pull it out before it gets burned even worse. But when it's just happening all the time, when the nerve is damaged and the pain never goes away, that's called chronic pain. And it causes really serious long-term problems, not only due to the pain, but in you emotionally. It can cause depression. It can cause other affective disorders. So chronic pain, not someplace you want to go. So is a herniated disc serious? 94% of the time, no, but can be because of compression or inflammation. There's a second thing that can happen. A herniated disc can be part of another more serious problem. For example, it's very rare, but sometimes you can get a tumor of the spine, and the tumor in the bone can cause the disc to lose integrity and for the disc to herniate. Well, you may find out about that tumor because of the herniated disc. Is cancer serious? Heck yeah. So finding out that you have a metastatic tumor, that would be serious. Another similar sort of, thank God, also very rare is infection. If infection occurs, the disc can lose its integrity, can rupture, and the herniated disc can be, in rare cases, the presentation of the infection. And then last, if the herniated disc is gigantic, this is very rare, but we talked about the motor and sensory control in your legs, but the other nerves that go right through your lower back control your bowel and your bladder function. If you have a giant disc herniation and you end up in the hospital or any kind of spine injury, they're going to ask you, are you having trouble controlling your bowel or bladder? The reason is those nerves go right through there and they're very sensitive to giant disruptions. If you lose bowel or bladder control, that's an emergency. and requires you to go to the emergency room. If you have a history of cancer, or this sudden onset of this back pain has been associated with fevers, shakes, chills, vomiting or vomiting blood or passing blood through your stool as either bright red blood or dark black stool called melena. If any of those things happen, that raises concerns that there could be one of these more serious and rare problems. It's very uncommon, but if you think you have one of these rare instances, just go to an emergency room. If you're worried about it but you're not sure, call your doctor. If your doctor can get you in the same day, that's a good way to run it by an expert and let them help you with the evaluation. But for most people, it's not going to be serious. The vast majority of the time, it's going to get better on its own. It's just going to really hurt as it improves. I hope these videos on herniated disc were helpful to you. It's a very common problem. It can be serious. It usually gets better by itself, but there's some stuff you got to know to make sure you're in the right group and taking care of yourself the right way. All of that information is in this series. Stay tuned to the clinic to get all of the information you need to take proper care of your body as you age, and find out what happened to Pat on future episodes.